Pregnant women take too many drugs. Pregnant women are usually prescribed more than 10 medications during their pregnancy. The French are known to be big consumers of drug. But what about pregnant women? A study by Inserm, published in September 2017 in the journal Pharmacoepidemiology and Drug Safety, shows that women in France are the biggest consumers of treatments in the world during their pregnancy. French researchers used data from more than 28,000 pregnant women, collected between 2011 and 2014. Result: the number of specialties prescribed, and at least partially reimbursed, during pregnancy varies from 11 to 14 in general in France, a much higher figure than in other European countries. In the Netherlands, women take an average of 8 treatments compared to 2 to 7 in German. American or Northern European women do not exceed 3 drugs per pregnancy. Sometimes useful prescription. In addition, the number of prescriptions did not decrease between 2011 and 2014, and remained at a high level, note the researcher. The latter specify that the study includes drugs in the strict sense of the term, but also homeopathy, vitamins or vaccinatio. Because supplements can be recommended for pregnant women, under certain conditions, anti-anemic preparations, mainly iron supplements, are prescribed for women who, in the 6th month of pregnancy, present a lack of red blood cell. About 70% of pregnant women were taking these treatments. We also recommend that women take folic acid, vitamin B9, before conception as well as during the first trimester of pregnancy to avoid certain malformations, explains Charles Garabedian, gynecologist obstetrician at the University Hospital of Lille. Other drugs, on the contrary, are particularly dangerous for pregnant women. This is the case of medicines containing valproate, depakine, for example. Over the 4 years that the study lasted, note the researchers, several thousand women would have been exposed to this teratogenic drug. Self-medication strongly discouraged. But the message to get across is that we must avoid self-medication, explains D. Charles Garabedia. A statement also made by the National Agency for the Safety of Medicines, which recalls that the patient must in no case take a medicine without having first taken advice from a health professional. If treatment proves to be necessary, it is up to the prescriber to assess the risk-benefit for the patient and her unborn child. The agency recalls that it is indeed difficult to analyze the risks associated with taking medication during pregnancy, because it is ethically impossible to ask a pregnant woman to test the evaluation of the treatments is therefore based solely on studies, conducted in animals, and on clinical observation data relating to women exposed to the product during their pregnancy. Since mid-October, pictograms have been put in place to help women find their way about drugs that are not recommended or prohibited during pregnancy. 60% of medicines will bear this sign, including a third of the prohibited pictogram and 2/3 of the danger pictogram.